Series of webinars for family and friend carers in New South Wales. My name's Sarah Judd-Lamb and I'm the Manager of Policy and Research at Carers New South Wales, the peak non-government organisation for carers in New South Wales. And I'm pleased to be joined by Jennifer Wright and Wayne Farmer from the Healthcare Complaints Commission today, and they are hosting the Microsoft Teams meeting. So thanks, Jen and Wayne, and I will introduce them again for their presentation later. If we could go to the next slide. Thanks, Wayne. So before we get started with today's content, I'd like to first acknowledge the traditional custodians of the land, or lands, I should say, that we are meeting on today. For myself and my colleague Grace in the Carers New South Wales head office, that's the Gorogal people of the Eora Nation. But as we've got HCCC joining as well, and a number of other people joining us today from probably different parts of New South Wales, we want to extend our respect to the elders past, present and emerging from all the lands represented today. Just to flag as well, so Wayne has started the recording for this session. We do record these sessions just to make sure that they're available to people that have registered and are unable to join us. So just keep that in mind as you contribute, and we will have a discussion time later in the session, but also if you can just please keep in mind to not disclose any confidential information in this forum. We also will talk a little bit more about the series that this is part of, but I will, if you can go to the next slide. So I mentioned briefly that we're the peak organisation for carers in New South Wales. I think many of you will be familiar with our work, but if not, we'll be redirecting you to the website later on. And next slide, please. So I guess the main thing to start with framing today's session is who are we talking about when we're talking about carers? So the topic for today's webinar is healthcare services and carers, what are your rights? And it's really focused on rights and complaints avenues from a carer perspective in New South Wales. With this webinar, as I said, is part 4 in a series called Know Your Rights, and it is a series that really focuses on what rights family and friend carers have when they have issues, experience issues in service access across a range of settings. Whether that is on behalf of the person that they're caring for, that person may experience problems with services, or whether it's the carer themselves being excluded from decision making or having their own issues in accessing services. So as you can see from that slide, when we talk about carers today, we are talking specifically about family and friend carers. So that definition excludes paid care workers and parents of children without additional needs, and foster carers of children without additional needs. We're really talking about people that are caring for someone that's got additional care needs, and there's over 850,000 carers matching that description in New South Wales. So that's who we're talking about today. And when we talk about healthcare services, we are looking at a whole different range of healthcare services, whether they're hospital services, community health services, primary health services like GPs. Health services can be a very broad definition, and the rights and complaints can be different in different settings. We are focusing on certain aspects of health services that are highlighted in a fact sheet on this topic, which we'll talk about later as well. If we can go to the next slide. So today's session, we are going to go into a little bit of depth on some of the content that's included in the fact sheet that corresponds with this webinar, which HCCC will be addressing. And then we'll have some discussion time. We've had some pre-submitted questions on this topic that we'll address together, and then bring it back into other topics that we're covering in this series that may be of interest. So the Healthcare Complaints Commission is a member of the Carer Rights and Complaints Network, or CRCN, which Carers New South Wales hosts, and which has developed a series of fact sheets on carer rights and complaints. So today, Jen and Wayne from the HCCC are going to be talking a little bit about what their agency does in this area, speaking a little bit more about how carers can engage with rights and complaints through their services, and then we will open up for discussion. So yeah, I think we can hand over to you now, Jen and Wayne, for your presentation.
Thanks, Sarah. We go. Thank you so much, everybody, for coming today, and thank you so much to Carers New South Wales and Sarah and Grace for inviting us to come along and have a chat with you today. My name's Jen. I'm the Engagement Officer here at the Healthcare Complaints Commission. So my role is really all about helping people understand who we are and what we do. And I'm here with my colleague, Wayne.
Good morning, everyone. My name's Wayne Farmer. I'm a resolution officer with the Commission, so I get involved when complaints have been assessed as being suitable for the mediation process where we help the parties come together to resolve concerns. I'll talk a little bit more about that as we go on, but thank you for inviting us to talk today. We've changed slides. So the Healthcare Complaints Commission, we're a government body, we're a government agency, we're independent, and we've been set up, we have the Healthcare Complaints Act, which is the legislation that governs our operations, and we're set up to essentially safeguard the public. And we're able to deal with all healthcare complaints relating to healthcare in New South Wales. So we deal with complaints about health organisations, we deal with complaints about individual practitioners as well. And we look at matters whether they're public or private. So if there's any provision of health service in New South Wales, it does fall under our jurisdiction.
I think sometimes as well, people aren't aware that, you know, they think they can make a complaint to us about doctors and nurses and dentists, which absolutely they can. But we also have jurisdiction with unregistered health practitioners, and that could be including counsellors, it can be including massage therapists, naturopaths. So the definition of a health service is quite broad, but we are the organisation in New South Wales that actually regulates the provision of health services.
And the types of complaints that we manage, primarily we're looking at the quality of care and treatment provided to a patient, so clinical care issues, but we do also look at the conduct of a professional conduct of a healthcare practitioner, be it whether they're a registered healthcare practitioner, such as your doctors and nurses and physiotherapists, etc., or as Jen touched on, we do also look at the conduct and behaviour of unregistered practitioners as well.
So raising concerns about healthcare, and I think we can sort of appreciate that it can be quite nerve-wracking to raise concerns about healthcare. You know, so we do understand and appreciate that. In the first instance, and if it's appropriate, and we understand it may not always be appropriate to raise concerns locally, but if it is appropriate, the best place to start is to actually contact the health service, the doctor, you know, the practitioner, to see if they can help. Because in our experience, and in most cases, practitioners and health services do want to work with people to resolve complaints. And if they don't know that there's been an issue or a problem, that they can't fix it. So there's a lot of good can come from actually, you know, having a conversation, you know, in the first instance quite early to see if the complaint can be resolved locally. And, you know, the role of the Commission really is if it can't be resolved locally, or if it's not appropriate to raise the complaint locally, you don't feel comfortable, then of course you can come to the Commission, you know, in the first instance as well. And we have a few tips, I guess, for raising concerns locally, because we understand that, you know, that can be, you know, quite a big thing to think about. So it's sometimes good just to reflect. Starting early, so starting when the problem first arises, so that there's an opportunity to, you know, correct things at an early stage can be really good. You know, and we encourage people to be fair. In some instances, the practitioner just may not be aware that there's been an issue or there's been a problem that's caused concern. So, you know, approaching it in a way that you want to resolve the situation if possible is a really great start. And it can be helpful just before approaching the health service or the practitioner to sort of have a think about what those concerns And I guess in a caring perspective, you may have concerns about the care and treatment that's being provided to the person that you're looking after and caring for. So it can be sort of helpful to sit down and write some notes about, you know, what were the main concerns, who was involved, what happened that has caused, you know, the issue to arise, and also what you'd like the person to do in response to the issues can be really helpful so that they can understand what might actually help to resolve that concern for you. And we do on our website have sort of a lot more information in this regard. We've got some tips about, you know, preparing to make a phone call. If you prefer to do it by writing a letter, there's some tips there about how to write a good letter to raise concerns. And, you know, if you're invited by the practitioner or the health service for a meeting, there's a bit of information there about how to prepare for a meeting like that. So that can be a really good approach in the first instance. But of course, sometimes things just can't be resolved locally, and, you know, the role of the Commission is actually to consider complaints impartially and independently. So we don't take sides, we're here to look at the information that's available and to work out what is in the best interest of public health and safety, and is there anything that we can do potentially to resolve the complaint, or for more serious complaints, they may need to go to an investigation process. So in making a complaint, part of the legislation is that complaints must be in writing. And so we know that that can be tricky, and if people don't have support and do need some assistance to make a complaint, we actually have an inquiry team here, and it is possible to make an appointment with an inquiry team and they can provide assistance. So that might be assistance with completing the form, the online portal form, or it might actually be assistance in actually taking the complaint. So we don't want to have any barriers for people to come to us, and so we have got the inquiry team in place and some other bits and pieces in place today to support that our service is accessible for people. We do say that online is easiest, and the reason for that is our complaints portal, the form there, it actually steps you through the really helpful information for us to have when we're considering a complaint. So it kind of prompts you to answer the questions and to give us the information that's going to help to streamline the way that we assess the complaint and help us understand your complaint better so that we can respond to the concerns that you've raised. So the online portal is really great at doing that. And the other benefit with lodging your complaint on the online portal is that you can also track the progress of your complaint. So you can actually log on and see, you know, where your complaint is at in our complaints process if you use that mechanism. So that's I think the most helpful way to lodge a complaint. But also we can take a letter via post, we will accept an email. So as long as the complaint is in writing, we will assess that complaint. I think one of the things that we like to explain is that the assessment can sometimes take some time. And I know that 60 days when you've made a complaint and you're wanting to know what's happened, you know, can seem like quite a long time. The reason that we actually have that parameter for assessing a complaint is because our assessment process is a very robust and thorough process. So the Commission will gather appropriate information. So once your complaint has been lodged with us, generally we will contact the health service or the provider that's involved and we'll ask them to respond to the issues that have been raised in the complaint. If the complaint is about an individual registered practitioner, we may need to consult with a health professional council. So that would be the Medical Council of New South Wales if it's about a doctor, the Nursing and Midwifery Council of New South Wales if it's about a nurse, and so forth. So with those registered professions, we co-regulate with the councils because the councils actually understand the standards and they can, you know, identify quite quickly the type of action that's appropriate to take in order to address any concerns that have been raised. Sometimes if the complaint has a very specific clinical element to it, you know, we may need to get some more independent advice from a peer or a clinical advisor. So it can take time to gather all of that information, and that's why the assessment process can take up to 60 days. But during that time, every time a complaint comes into the Commission, it will be assigned to a case officer. So you will actually have one point of contact here at the Commission. And if you have questions along the way, you can actually contact that person. You can drop them an email, you can give them a call, and you can, ask them how things are progressing. You can provide additional information if it becomes available. So it's good to know that that's part of the process as well. And then once the Commission has assessed the complaint, we will advise you of the outcome in writing. So you'll actually receive a letter that outlines what the assessment has found and what the outcome of the assessment's been. Sometimes someone will get a letter and they'll feel that potentially we've missed the issue, we haven't looked at the particular concern that they really wanted to be addressed. And, sometimes things like that can happen. We might have missed something, or sometimes in the process of that 60 days of us assessing a complaint and gathering information, potentially there might be more or new information that's come to light that we didn't have at the time. So we also have a review process where people can actually lodge a request for review if they feel that we've missed something or if there's some new information that they'd like us to consider. So that's another part of the process as well. And I'm going to hand over to Wayne now to talk a little bit about outcomes of the assessment process, what they might be. Wayne, I will hand over to you.
Thanks, Jen. So as Jen's mentioned, the first part of our complaint process is that we collect information to make an assessment decision as to how best to manage the complaint moving forward. And there's a range of possible assessment decisions or outcomes that are available to the Commission. Now, as we've said, our usual process is that we'll write to the healthcare provider, we'll provide a copy of the complaint in most cases, and we'll seek usually a written response from the health service. And on most occasions, we'll provide that information to the person who's made the complaint to see where we've landed in addressing some of those concerns, as well as looking at from the public health and safety issue from the Commission's point of view. And in that process, sometimes we find that the provision of that information, particularly where there's been communication issues, is sufficient to actually resolve the complaint during the assessment process. So we do have capacity to conclude our dealings there and make a decision that the matter has been resolved in assessment, if that's an outcome that the parties feel that has been achieved. If the Commission looks at a matter and identifies that, look, there's not a significant public health and safety concern necessarily that warrants further formal investigation by the Commission or outstanding issues that the Commission needs to remain involved in, we may write to the parties with a decision that we're discontinuing dealing with the complaint. In those circumstances, likewise, we'll usually provide information about what the response is and what our assessment process was, why we've reached the decision we have, and we'll detail that in a letter to you, detailing what the outcome was. If there are concerns that you have, or as Jen's mentioned, if you feel that we've missed some of the points or there's new information, you do have the right to seek a review of that assessment decision.
And I think that's probably one of the key things. It's because discontinue sounds like, quite a strong word. And I think it's important to note that every complaint that's made in good faith is valuable because it offers an opportunity for the health service or the practitioner to reflect on what's happened. And even if, after that robust process of gathering the appropriate information and risk assessing what's happened and deciding that potentially there isn't any further action that the Commission can take in relation, it doesn't mean that, we haven't done a robust assessment at our end and that we haven't allowed an opportunity there for health services to reflect on what might have been done differently. They can still be really valuable learning opportunities. So I always sort of like to say that when we say discontinue, because it does seem sort of quite...
Yeah, it's important to remember that every complaint made to us is important. So, it's an opportunity to provide the Commission with information about what's happening. It's an opportunity for the health service to address and respond to needs. So, as Jen said, it can feel a little disheartening if there's a decision made to discontinue dealing with the complaint from the Commission's perspective. But I would hope that our reasoning and explanation that we provide to you would also provide some comfort in explaining our decision.
And I think that as well with comments, sometimes we'll identify something where we're not going to be taking further action via one of these other options, but we've noticed something that could have been done better, and it's an opportunity there for us to actually, as the regulator, to make comments to the practitioner, and sometimes we do decide to do that. So we'll make comments to the practitioner about what we identified, and we'll point them in the right direction to the right guides or policies or resources, and ask them to actually address that particular element of their practice to mitigate the risk of a similar event occurring in future. So that's one of the other ways that, even if a complaint, if we do decide to make comments, that we are still trying to, in everything we do, look at how service and health service delivery can be improved. So that's sort of what discontinue with comments.
So working our way down the possible outcomes of the assessment, you can see here that the third one down is refer to appropriate health professional counsel. So this is where we've said that when we're dealing with those complaints about practitioners who require professional registration, so your medical practitioners, your nurses, midwives, physiotherapists, just to give some examples, because we co-regulate with the relevant professional counsel, on some occasions when we assess the matter, we'll identify that there may be issues that are appropriate for that professional counsel to continue to manage and deal with those issues directly, and so we'll refer the complaint across to them to manage moving forward. Other times as well, we may see that there's a need to try and, whilst it's not a matter that requires a formal investigation by the Commission, once we've assessed the matter, we can see that there's a need to try and help the parties to resolve the issues. And particularly when we are dealing with public health organisations or facilities, particularly where they have quite robust complaints management systems in place, and where we can see that there may not be certain barriers in place or failed attempts with the parties trying to address concerns directly, we may refer the matter for a local resolution process, so as those facilities can bring into play their robust complaints handling procedures and help the parties come together and manage that.
And I think a note on that, and it probably goes back to what we were saying before about raising concerns locally, if the concerns about a public hospital, you'll generally find that there's a complaints manager in every local health district who actually will take complaints, will follow up, will liaise with you and try and resolve concerns. So sometimes what happens is a complaint might come to us directly, and then we realise that the issues that have been raised are lower level issues, and they're the kinds of issues that a good local resolution process and potentially the complaints manager getting involved and providing people with some answers and some reassurance about how things can move forward can be a valuable way of actually resolving the complaint. So local resolution can be quite a powerful tool for that.
Where the Commission looks at a matter and feels as though we want to, again, like local resolution, we want to help the parties to reach a resolution of the complaint. In certain circumstances, it may be the view that a local resolution process might not be the best way to go. Now, this can be certainly for individual practitioners or where there's been failed attempts to resolve concerns locally already. There may be a breakdown in the relationship, a breakdown in the level of trust. There might be complex clinical issues. And we have the Commission's resolution officers, which I am, as I've mentioned, who are able to actually stay involved from the Commission's end, and we can help the parties navigate a way forward and to reach a resolution. So we can refer the matter for the Commission's assisted resolution pathway. And we've got a case study later on in the presentation just detailing a little bit more information on that. Sometimes the Commission, when we assess a complaint, we may need to refer to another body. And so some examples, for example, if we are dealing with a complaint or a concern around people's access to health care records and the like, we may actually determine that it's appropriate to refer the matter to the Information and Privacy Commission. Or if a complaint is about fees and charges and a consumer dispute around those sorts of things, we may refer the complaint on to Fair Trading, for example, who have the appropriate jurisdiction in those areas. Some matters may also involve rarely, but it does happen, like a criminal element, and we may refer the matter to the police to look into those side of things as well. So there's a range of other facility organisations that we may need to refer a complaint on to.
And I think we can all recognise that this is a very complex space, and there are a lot of different organisations and complaints handling bodies, and it's, you know, to navigate that can be quite tricky. And I think that's why our inquiry service is a really good first port of call. So if you're not sure, is this the kind of complaint that the Commission would handle, you can actually ring our inquiry line and speak to a person. They can have a chat with you about what your concerns are, and they can kind of let you know, look, yes, that definitely sounds like something that you would, you know, it would be well worth you raising that with us, and here's the process, and this is how you can go about making a written complaint. Or if they feel that, you know, what's being raised might be best handled by another body, rather than waiting till the end of our assessment process in 60 days, potentially at an early stage, that inquiry line, our officers there can help point people in the right direction. You know, for example, I think one of the examples Wayne just mentioned was, you know, sometimes people have tried to get access to their medical records and they've been unable to get access to their medical records, and actually the Information and Privacy Commission would be the body best placed to consider that kind of issue. So we understand that, you know, to understand all of these different bodies and what they do is quite a complex thing, and that's where our inquiry line is always very, very happy to help people if they want to just give us a call and ask for a little bit of advice. So I think that's a good thing to point out there.
I think it's important there that you touched on it, Jem, because often you don't know what you don't know, and agencies like ours, we deal with complaint matters all the time. That's our core business. So if there's any doubt, certainly contact our inquiry service, and we can often point you in the right direction if it's not a particular matter that, you know, that the Commission's best suited to deal with. We can certainly point you in the right direction, and you know, the inquiry staff are really helpful in trying to help people sort through matters. One of the other outcomes that are possible from at the conclusion of the Commission's assessment is where there are some circumstances where we identify that there's a significant public health and safety concern, and this is usually when we're dealing with a facility. So in those issues, we may refer for a formal investigation, and on the back of that investigation, if we identify, yes, there is a particular public health and safety concern, we have the capacity to make formal recommendations to the health service as a result of the investigation, if that's warranted. Also, as we've mentioned, we do regulate individual healthcare practitioners. So if there was, at the assessment stage, it was identified that it appeared likely that there were quite significant departures from the appropriate professional standards, care and treatment and conduct of an individual practitioner, the Commission can refer those matters for investigation, and we'd be the body who actually have the mechanism to prosecute individual practitioners to seek conditions on registration and the like. It's not a common thing that happens, but that's another way that we can help safeguard the public. So that's one outcome in terms of the outcomes available to the Commission. So some of the things that the Commission is not able to do. So the Commission's not able to force a practitioner to see a patient. The Commission's also not able to direct a healthcare service or a healthcare provider to take specific action to resolve a complaint. We can't order a refund or a fee reduction. We don't get involved in the awarding of damages or compensation. We don't make any determination as to whether you might be entitled to damages or compensation. If there's, you know, complaints that are raising those sorts of issues where you feel that there's a need to explore that, then the Commission would suggest that you speak to it and get some legal advice in relation to that. The Commission also can't direct a health service provider to change records, but if there are aspects of the healthcare record that you feel are incorrect or don't agree with, there are mechanisms for trying to resolve that, and we can talk you through how to best manage that. And as we say, sometimes matters there's a need to refer to the Privacy Commission as well, who have a role in some of those areas. So we have, at the moment, this is just a case study of a complaint received, relating to a complaint made by a carer. I'll just give you a moment just to read through this complaint on screen. So we can see we've got a carer who's made a complaint about his sister's experience. And just to touch on that, so any person can lodge a complaint to the Commission. It doesn't have to be the individual or the patient that's receiving the care, so that's perfectly fine for that carer, family member, any person to lodge the complaint. In this case, there were concerns raised about communication issues, what was felt a lack of patient-centred care and psychological support. So I guess, sorry, Jen, you.
We thought we'd return to this screen and just give you an opportunity to have a little think about that particular case study and to think about what the Commission, the assessment outcome and what the Commission might have decided to do in relation to a complaint of that nature. And in the chat box, if you wanted to, you could jump in there and let us know your thoughts about what the Commission might have done. So I don't know if you, with the chat box,
I can't see anything coming up there at the moment, so I guess we'll step you through this. So in this case, this is a broad look at the matter. There may be individual nuances here at play, but this type of matter is likely to be a matter that we might refer for an assisted resolution process. Often when we're looking at assisted resolution, where the Commission's resolution officers stay involved to help the parties, some of the factors that we're looking at here is, are the people, are they a vulnerable cohort of people who may need some assistance? Are there issues where there's ongoing treatment likely and a need to, bring the parties together to rebuild that trust? These are often factors that we look at when determining, if it's appropriate for the Commission to stay involved. So that's the likely sort of outcome that would be with this sort of case study. So in this case, the resolution officer can actually sit down. So the typical situation would be that we've requested a response to the complaint. We've provided the information out to the complainant and the parties, and so we help you work through. Okay, what's been explained in the response at the moment? What issues have been addressed? Perhaps what issues might be outstanding? Sometimes it can be difficult for parties to even fully understand, and to articulate what it is that the concerns are, or what the outcomes are that they may be seeking. So we help the parties explore and navigate through those points, and then we help the parties come together to communicate and reach an agreeable way forward. The resolution process is a voluntary process. It's not something we force on parties, but it is certainly a useful process for helping to resolve concerns. Often it can involve bringing the parties together for a meeting to explore the issues in a face-to-face setting. Sometimes parties would prefer not to do that, or it might not be convenient to do that. We're able to run them sometimes over a video conference. Other times it might be that just the exchange of some further information might be sufficient to help resolve the complaint. So that might be the Commission officer, the resolution officer, negotiating between the parties and relaying and passing on information to help address concerns and reach an outcome, or it might be a further written response that the Commission might obtain and pass on to the parties to help resolve a complaint and reach an agreeable outcome. But that's an example of an assisted resolution process.
So I think that brings us to sort of the conclusion of what we had prepared to chat about today. I know that I'd mentioned it before, but our inquiry line, genuinely, the people that are staffing the line are very, very helpful. They're very happy to chat to people and to help point people in the right direction and to provide them with some advice if they do wish to go ahead and make a written complaint. So that's our inquiry line number there. And also we redid our website about a year ago. So it's actually quite a good source of information. And I know I mentioned before there's some tips on there about how to resolve, how to raise concerns locally and how to prepare for meetings and any direct action that you might be taking to try and resolve healthcare concerns. So that's a really good place to go and find information as well. So I hope that that information is been helpful today. I believe that there might be some questions coming our way, which we're very happy to take. So I might just let Grace or Sarah jump in and we can talk through any questions people might have.
Fantastic. Thanks so much, Jen and Wayne. And is it possible to bring those slides back up just for the last part of the webinar? So we might actually just go back. Actually, sorry, just having a look at the slides. Could we go forward one?
Yes, of course.
Yeah, I just want to draw everyone's attention to the fact sheets that are behind these webinars. So I mentioned earlier that this fact sheet is part of a series of webinars that's based on a series of fact sheets. So there's a web address there where you can download the Healthcare Services fact sheet that this webinar is based on, and there are references to the Healthcare Complaints Commission there as well. But really want to emphasise as well, as Jen said, that the HCCC website and information line is a really important resource, and something that I guess is a real key theme of these webinars and fact sheets is Carers New South Wales wants to try and make these pathways as easy as possible to access for carers. And as Jen said before, you know, service systems are complicated. We know working with carers every day that, you know, sometimes they just don't have time or energy, or it's just really, really overwhelming trying to understand where to go for various things. But one great thing about the project that created the webinars and fact sheets that we're speaking about today is that we work with a number of complaints agencies, including HCCC, and a number of them are really, really, really committed to having accessible information and advice where people can just call if they're not sure what to do, and then have you know, more information provided about next steps. And so yeah, just wanted to reiterate that HCCC is one of those, and really we want to encourage carers that are having issues in these areas to make that call, and I guess just look at what options might be available. And yeah, and even if it is around advice about speaking to the people involved, it's a really, really good source of information. So before we kind of bring it back to that series, we do have a few pre-submitted questions, as Jen said. Some may have been covered already, but I might still just go through those and see if there's any you wanted to address or that we can contribute to.
Sure.
If anyone else has questions as well, I think probably you can put them in the chat and Wayne can let us know if any come through. If I can just throw you a question that's from our pre-submitted list. You mentioned your website, Jen, and this may have partially been covered already, but a question was, does HCCC have resources available in easy read and other languages to support people with intellectual disability, low literacy or culturally and linguistically diverse backgrounds to make a complaint?
Yeah, we do. So, well, we use the TIS service. So anybody who would prefer to receive information in another language or wants to speak to somebody in another language can use that service. We also provide our complaint forms in a variety of different languages, and even if they're returned to us in a different language, we'll organise for that to be translated. So, again, we want to be accessible to as many people as possible. And in terms of information, we do have on our website, there's a little brochure called Not Happy with Your Doctor, and it's a plain English brochure which just takes you through with pictures, what our process is, what to expect, and what you can do to manage healthcare concerns. So we do have different resources, and we're obviously committed to making sure that people can get in touch with us. But again, I think I'll go back to saying that the inquiry line is a really great first port of call, to get some advice about what options are available to you.
And I guess the other point, and Jen touched on this earlier, that it is a requirement under the Act that we receive a complaint in writing, and we know that's challenging for a lot of people. And our inquiry officers, we can actually, if the need arises, so we can help you to fill in the complaint form, but we can even draft a complaint for you if that's what's required.
Yeah.
So under the Act, we're able to do that for you. So we certainly understand that it can be difficult to put a complaint in writing, and we don't want a situation where somebody feels as though they can't meet those requirements.
That's great. I know that's like a barrier that comes up, not necessarily this context, but a lot of carers just feel overwhelmed at the prospect of having to do more paperwork. So I think it's great that there's options available for support with that. Another question that we had that came up, excuse me, was and it's come up in a number of our other webinars actually, is around what happens in small towns. So where there's a negative experience with a particular healthcare service, but there's maybe not any other choice, and there's a bit of a fear around affecting their service use. Was there anything you wanted to add on that, either Jen or Wayne?
Yeah, I mean, we've actually, we've just been talking this morning in our all-staff meeting about, we do a lot of work out in rural and regional areas, to raise awareness of our service. We know that there's some really unique challenges out there, and completely understandable that people would feel concerned about raising their worries with, the only doctor or the only health service that's available in town. And I think this is where, going back to what we were talking about before about being prepared to raise things locally, and framing that not necessarily as as a complaint, but just to set up an opportunity to talk with the health service. And again, if it's the local health district, it might be having a chat with the complaints managers there, or sending some information through there. They're really committed to understanding these kinds of things. But if it is the local health service or the local doctor, to go through those steps about writing everything down, being fair, understanding they may not be aware of what's happened that's caused the concern, stepping out what the issues were for the person, and really what they'd like to see happen moving forward. So I guess for both parties, and we would be encouraging health providers to take exactly the same course of action, is that this is about restoring trust wherever possible. And again, as Wayne was saying, it may be that if this is an event that's happened in a rural or regional remote area, it's the only health service available, and the person has felt like they've come to the end of the road about what they can do to repair that relationship locally, can come to us, and it may end up, I can't guarantee, but it may end up the type of matter that we would consider for assisted resolution, particularly where somebody has ongoing need for care, and it's not that they just go to the doctor once every 6 months for a checkup. They actually need to access that service regularly in order to stay well, and they're the types of things that we might consider in our assessment outcome. What's the best way that we could help this person and this service to reconnect and rebuild that trust again?
We often see in complaints, so many of the matters often communication is at the heart of the matter. Parties aren't understanding each other, or haven't felt heard, and that's particularly where if a matter is referred for a resolution process, or even a well-worded and structured complaint or letter, whether that's locally or through our pathways, is about rebuilding that, and that communication strengthening the communication and rebuilding the relationship. I should say in most of the matters that I have where matters go for an assisted resolution, the majority of people, and this includes the providers, at the conclusion of those processes are quite grateful that there's been an opportunity to work through and resolve issues. I mean, I think, it's fair to say that the bulk of healthcare practitioners are there because they care and they do want to be able to help. And sometimes there can be a situation where, through whatever reason, relationships have broken down, and sometimes that third party is there to help rebuild and help people feel heard. So there's more often than not a way forward. We would encourage people to raise their concerns rather than sort of sit on it and worry that they can't.
Thanks for that. And we've got a couple of other questions I think that maybe follow on from that, which I might put together. So I guess this may happen in a small town particularly, or it may just happen in, as you were saying, where someone is very reliant on a particular ongoing health service. So the first additional question is, what happens if an issue has been raised and escalated, and happens again with the same provider? And another question kind of along those lines is, if there's a particular healthcare worker within a service that's just not a good fit, how do you navigate kind of changing those arrangements so that you're still able to access the service that's required and available, but able to, I guess, be at arm's length from some of those ongoing issues?
Yeah, and I think that's a tricky one because, obviously as the Commission, we can't direct a health service that, only certain practitioners can, care for certain people. And to me, I think those kind of issues are those kind of issues that, as Wayne said, raising those locally in the first instance and being open to suggestions and actually working with the health service to say, look, we really want to move forward. We just want the best care for our loved one. We know that in general, they want to provide good care as well. And so actually sort of being in that space to have an open conversation and to see what options and what solutions might be able to be arranged locally is a really good first start. And then, when things can't be resolved, or if things can't be resolved, or if it's not appropriate to have that local conversation, to come to us, let the Commission assess the complaint. And again, every single complaint is assessed on its merits, it's assessed on the information, it's assessed on a case-by-case basis. So we can never really, say what the outcome of a particular concern or issue is going to be. But I think if those ongoing concerns remain, they continue, that's why we're here. We're the Healthcare Complaints Commission. We're here to independently and impartially look at these kinds of issues. And, that would be something to consider raising with us as a written complaint.
And I guess, just adding to that question, there was a second element, I guess, where you're saying if it's a matter that the Commission's already looked into and dealt with, we've helped the parties perhaps achieve an outcome, but then the issue arises again, the parties can lodge a further complaint if that is the case. But the Commission will look at it on its merits about, what's the situation at the moment. Is there the public health and safety concern? We'll still go through our robust assessment decision to see where we land with that. And it may be that, yes, it's appropriate to go for a resolution process again to see if we can find a way forward. Importantly, and particularly where we're working with public health facilities, part of that resolution process as well is reconnecting the parties. And so often, we're aware that sometimes some of these issues may arise from time to time, but the parties often leave with knowing, okay, what are the escalation points within the health service if this happens again? So, often we can get to the end of a resolution process, but the parties know where to go and what to do if matters happen again. There's a plan in place moving forward because, with some issues, it's foreseeable that certain issues may perhaps happen again, and so the big question is how do you manage that? And so that's again where resolution is helpful to come up with a plan moving forward. But you certainly can raise if you've raised one matter and it happens again, you're certainly not barred from coming back to the Commission.
Thanks for that. And it's great to have both of your perspectives, I think, especially Wayne, kind of that frontline perspective about how things are managed. It's really great. I might just give you one more question specifically about the HCCC, and then there's a couple of questions relating to care recognition, which I think we may be better placed to answer that we can probably wrap up with. One thing that does come up in a lot of these webinars as well is when we're looking at complaints bodies, obviously, you know, raising something with the complaints agency is kind of a form of escalation once you've dealt with it at a local level. But what if someone is not actually happy with HCCC's response or decision around a complaint?
Yeah, so I think as we mentioned before, that review function is there. So, you know, look, there may be times when we don't get it quite right, and that's why we have that review function. So again, that review, the purpose of a review is if you think we've missed something, if there's something that we haven't assessed correctly, or if new information has come to light, the person can request a review. The person can lodge another complaint with us if you know, a separate issue arises in the same service at a later date. And I think that's something that Wayne touched on. So, you know, we do have those mechanisms in place. Generally with our reviews, we do find, you know, and I think as I mentioned before, we do have a really robust assessment process here, and a lot of care is taken in considering the complaint issues, considering the risks that have been raised, and always with that eye of protecting the health and safety of the public. So in general, the decisions tend to remain fairly consistent. However, occasionally we will change our assessment decision if we find that there are elements that haven't been fully considered and actually warrant a different outcome. So I guess there is that mechanism there, you know, because we want to make sure that we're getting this right as well.
And I guess just to expand it as well, I mean, as a government agency, New South Wales government agency, if there's concerns around our administrative processes or the conduct of an individual person from our organisation, apart from obviously raising the issue, you know, with the Commission and through our own management process, you can raise a concern with the New South Wales Ombudsman, but the Ombudsman is there to look at our processes and complaints about, you know, the services provided. They don't review our assessment decisions as such, but there is that capacity there to lodge a complaint to the Ombudsman if you're concerned about, you know, the manner in which we've dealt with your concerns.
Thanks for clarifying that. So the remaining two questions I wanted to address were just around care recognition. So one of the pre-submitted questions we had was, will this session cover the New South Wales Health's obligation under care recognition legislation, and including care identification in admission under the patient administration system. So as you'll probably realise at 5 to 1, that's not a focus of today's webinar for those who are interested. And the reason is the fact sheets and webinars under this series, Know Your Rights, are specifically focused on rights that can be upheld through specific complaints pathways. So if you have a look at the fact sheets, which I mentioned earlier, and maybe actually can we go to that slide again, the next one, Jen, just so we've got that link up.
Yeah.
You'll note that those fact sheets all say that the focus is basically enforceable rights, and unfortunately, Carers Recognition Act and Carers Charter, while embedded in legislation, there's sort of limited recourse in that there's not a specific complaints mechanism that can lead those principles to be enforced. So that's why we're focusing in these webinars on things that there's a definite pathway for things to be dealt with. But we recognise, of course, that the New South Wales Carers Recognition Act and New South Wales Carers Charter have some very important principles which link to obligations for public sector agencies, whether they be complaints agencies or actual service agencies, and that New South Wales Health has a number of obligations under that. So while that's not the focus of today's session, I guess I just wanted to comment briefly on that, which is that if people are not aware, so there's a document called Key Directions in the health context, which basically outlines how New South Wales Health, which is the public health system, is going to recognise and support carers. That document its outer limit is 2020, and that's because as part of the new South Wales Carers strategy that was launched in 2020, which is a 10-year whole of government carers strategy, those key directions are going to be updated. And I know there's some different projects happening in New South Wales Health at the moment around looking at strategic actions around carers, including one that we were a part of last week in Elevating the Human Experience, which has a lot of inclusion of carer voices and representatives in that process. So I guess just stay tuned for those processes. I'm happy to liaise with people outside of this session around that. But in the next 10 years, which is a long time, but specifically in the next year and a bit, under the first action plan of the New South Wales Carers strategy, there's going to be a fair few projects that New South Wales Health will be directly involved in around carers. So we might, when we send a follow-up email to those that registered today, we might include the Carers Strategy Action Plan, if Grace, you can note that. And so, yeah, to wrap up, I suppose, given that we've got a couple of minutes to one, first of all, just to really thank Jen and Wayne for giving us all the details about HCCC and for answering those questions very thoroughly, and for hosting our Microsoft Teams meeting and recording today. So thanks, Jen and Wayne.
Thank you.
And just a reminder to really check out the fact sheet from today, which does touch on key points. The fact sheet for health services, fact sheet number 4, as with all of the fact sheets in this series, it was a very in-depth piece of work between Carers New South Wales and the relevant complaints agencies, with input from carers and other stakeholder groups, to try and capture the most important information in the most straightforward way, to limit the complexity of understanding where to go for different complaints and issues. So happy to take your feedback on that fact sheet, but hopefully that can be a brief reference to where to go on different types of health issues. There is also, I guess, there's related points in some of the other fact sheets which look at different settings. So there is a fact sheet which is pictured there on mental health services, which we will be addressing in a webinar next month, middle of next month. And there is some overlap between the health and mental health pathways just due to them sitting sometimes in the public health system. So we'd encourage you to look at those fact sheets, also to think about whether you would be interested in future webinars. As I said, next month is the mental health services webinar. These webinars are monthly, free, and happen mid-month on a Wednesday, 12 p.m. So have a look at that website. You'll see the future ones that are scheduled. And then we've got 8 in total. So they'll be monthly until September. And then we'll be looking at other future opportunities as well. So thanks again for joining us. If we can go to the final slide, we might wrap up there. And as I mentioned, we'll send a follow-up email to everyone that registered. We will also send around the recording when that's available and has been uploaded. And we will send a little evaluation form around if people have a moment just to provide feedback, as well as links to HCCC information and to the fact sheets as well, so that everybody has that all in one. So thank you, everybody, and we'll hope to see you next time.
Thank you very much.
Thanks for your time.
Thanks for your time.
Thanks, everyone.
Thank you.